Okay, this is a video recording, obviously, on how we can improve the residents' oral health and how that can help improve their well-being. And in that picture there is me at the beginning of the year, at my camper van, and I just finished reading this book by Chris Anderson, who ran TED Talks. And so he's kind of a call to action really for everybody. So we'll get back to that in the end. But this is a bit of history about dentistry. And this is the one where I put my picture in. That's enough. I see I got my glasses on. Right, anyway, and this chap, William Guys, I think he was the first person to start talking about the dental plaque, and he invented a toothpaste called Pepsodent. And the idea was then that it was going to dissolve the plaque that appeared around the teeth. And so that was his thing. But he wasn't getting very far. And so what happened was he had a mate called Claude Hopkins, who worked in advertising. And so this was the book. And it's a free download now. And basically he described the film. So he looked at people, and he wasn't a dentist. He went through the literature and decided what he could do was talking about the film around the teeth. And I'm pretty sure it was him who started talking about the ring of confidence, but I couldn't find an original picture on that. Anyway, moving on, it was always about the plaque until more recently. So this is 1994, the first person who mentioned disrupting the microbiofilm, and this is what he wrote. So you can pause it here, but maybe it's a lot of these academic articles are a hard read. But if you run it through ChatGPT and ask for it just to try and explain it in layman's terms, this is what you get. And yeah, keep it to 100 words. You'll probably do that with this. Anyway, so that's disrupting the biofilm. So we will come back to that. And the latest research, I'm still in the process of finding out. But I've gone round the houses from the professors that I've met. And these are the people in the top there. They're the ones who are most active from Hong Kong. There's very little around what I think is a solution for what was a big problem that you would have read about, because I just summarised the current literature. And this is to explain what's going on. So this is me painting. So I'm going to talk over this now. So what we're talking about is the actual state of the teeth. And this is what they look. You've got the enamel, the dentine, and then what you call the nerve. The black triangle is what happens when the gum shrinks back, and you get food stuck in there. And when it shrinks back a bit more, which we call maturing, the teeth can be sensitive through the dentine. And at the same time, the dentine gets lights down. And so the actual nerve of the tooth gets smaller, as you'd say, which is why you don't get so much pain. But all the food debris around there, what happens there is that sort of proliferates, and the toxins and the change, and the bacteria change in there. And the bacteria that are sort of sitting down in between the gaps in the teeth and down the gum, they can then go in the bloodstream, and then they can go into obviously they go into the lungs, which is where you get the respiratory disease. Although some people think you can still get problems with the lungs and diseases in the lungs, even from the bloodborne path. Right, and so if you wanted to know the sort of how it can improve and the mode of action, I've made lots of videos on this. The interesting one is the Smith test, so have a look at that. It looks like I did it as a Christmas thing, but it actually works. It shows the difference between inflammation and disease. So I've got lots of videos on YouTube. So type in toothbrushing, periodontal disease, gum disease, asynchronous cleaning, asynchronous checkups, all for care homes. So I would have put, you want references, but most of my references now are not going to be dental references. And I'm on LinkedIn, and on LinkedIn I've started putting on these black box videos. So there's one on about antibiotics, and I'm pretty sure this one was about affordable care when I went to the care homes. I've been going to a care home for quite a lot, trying to work out how we can improve things. And the basic thing is the people in the care homes, the staff, they can't afford to see a dentist anyway. And it's an appalling situation that we're in. And it's just how can we sort it out? And satisficing, I thought that was a computer term, but basically, what it means is doing something that's good enough. Now that certainly applies to people at the end of life, although we can do the same thing but the same product for the people at the beginning of life. And again, so this is another book that I've read or listened to, and it's just trying to think where we can do something that's slightly different that will work. And this I made, I didn't think I put the slides on. This I made basically how we can run a health service better, but we need a lot more input. Yeah, so it's got all the people that input, and by the same thing, you do it with care homes. So I'm seeing, obviously talking to the carers, talking to the managers, talking to the people who actually do the work, nurses, how we can get them to go in. And so that's how it works. What you want is you want a diverse group. Otherwise, I think you get what's called echo chambers or bird cages, or where people just repeat what the boss thinks, which is not a good way to be. And this chap, I come across him quite a while ago, and he was big in how we can improve health, and it's this disruptive innovation. Well, he did a lot about health with it. And if you just look online, you'll see him talking about it. And so I did it originally with regard to how we can do something about mouth cancer. So this is, I've taken slides from elsewhere, but basically the more involved that you get, the further up the chain you go, the more expensive it is. So getting dentists to go into care homes is really tricky. And if you have to get them to go into specialist units, that's more expensive, and if they get to hospital, that's even worse. And that applies in lots of things. So this was actually what I made for mouth cancer, how you can screen yourself. So I don't think, but yeah, I screenshot this. But basically that was showing what we can do and how you can almost avoid it. But the problem was that the idea was you take photos on your phone and just post them on. And this happened to a patient of mine. She had a photo taken of what she thought was a mouth cancer, and she went to see the doctor instead of the dentist. If she'd have sent me the photo, I could have told her what it was. She had a sharp tooth, and the ulcer on her mouth lasted for more than a couple of weeks because she had a sharp tooth. So there's lots of things that we can do. But the problem we have is that people are always twitchy about what they will allow. So when I contact people who were doing this, which was skin analytics, they wouldn't allow me to use their encrypted messaging because what they said is that if someone analysed incorrectly, then they get sued. So they'd rather not do it than risk making an error. Well, I think my view is that that sometimes some errors will be made, but amount of people that it would reassure, I think outweighs it. I think we've gone the wrong way. As long as it's got a disclaimer saying if it persists, do this, and go and get another checkup. But we work in a climate of fear, whatever we do. Yeah, and I didn't know how to put that on. And what I did do was I went on a course on innovation, and so this one I think was made for making a dental app. On the right you can see I did an application for SBI funding. I think that's about 14 pages long, and it took a long time, and I had help with that, but still didn't get anywhere when it come to that. So I've done a few of these applications for mouth cancer, not dental hubs, health hubs, and they're all on YouTube anyway. And these are the references I get. So I think I said I started doing this when my dad got ill with his dementia, and I drive up to and from Anglesey from Bristol, and I listen to audiobooks. I do concentrate driving, but I use a lot of these audiobooks, and clearly these are I find these really fascinating and interesting. You don't get too many good books on dentistry to listen to. So this is just one of them. He's always mentioned Cialdini and it's about it's advertising, but it's human behaviour. And so the person I really like listening to on behavioural science is this Rory Sutherland. So you can download on iPlayer his radio on program on hacking the unconscious, and it's funny, but it's clever. And what they say about the health service, I think that's number 5 or 6. That is really funny, but sad. Yeah, and the book Alchemy, I've listened to that quite a few times. I don't have his book. I've listened to it, but what he talks about is one of the things about how we reframe things. And the thing about we have about HS2, how much it costs, basically is right. People want to get somewhere quicker, but sometimes just making it more pleasant is better. Now, and since they started developing it, whether 5G is good or not, but you can work on the train. I mean, everybody's sitting there, well, listening to podcasts or playing on their laptop. But yeah, so great listen. But how can we use what he says? I think one of the stories he talks about is that unfortunately, we're all human. Our interests in dentistry only come when we have a problem. But the oral microbiome has been shown to be related to 57 diseases. Well, one of them most interest is erectile dysfunction, which is why I made this video. But the thing that I'm also interested in, and I've left this video out, I think, is, we might come on to it later, is how we can apply it for applying silver diamine fluoride, which is something I'm really interested in. But we're talking about business, so if you're going to have people come to a care home, it has to be business-like. And so there are these different books that I've looked at, and I think I've made another copy of them. But what we are is we're a health business where health comes first. We're not in the business of health, which unfortunately I ended up working for, and I think that the health service is going the wrong way. It forgets it should be a service. Oh, I put a sticker in there. Oh yes, and the main thing that people have with us, certainly in dentistry, is they trust us. It's just staff that we have to write so much notes, and this happens everywhere, for the lawyers, not for the people we look after. The 5 minutes spent talking to someone is far better than 20 minutes writing it all down. You can tell I was a lousy typer, which is why I prefer talking. So these are the books, some of the books I have read, and this is where I work now, in my office, in my garden. So Faster Cures. So he was someone that very interesting book again, and you can, if you look him up on YouTube, the Diary of the CEO, he's spoken to him, but he employs people before young graduates in medicine. He had leukemia, and his prognosis was really poor, and he had lots of money, so he paid medics to investigate his issue basically, and he's still with us. And so that's how he thinks we can improve health, by catching people before they get stuck in the hierarchy of the medical profession. Lean Startup, well, I got that when I made my app, and I've applied it to how we can improve things. So all my videos, like this one, I can amend quite quickly and easily. So when I say something wrong, I can change it. Timpson, I was there yesterday getting keys cut, and asked the guy about some of the things that they have there and the autonomy they have to work. And what is written in the book is true. I mean, it's a great way to work. People are happy. And this chap had his own business, but he's been with these now for like over 20 years. The dementia stuff, obviously, that's dentally orientated. And go to Richard Sounds. That's how he runs his business. He's getting older, so he's given all the shares to the people that work for him, similar to John Lewis. The scientific advertising, well, that's the original copy. It isn't quite as relevant because back then they were giving coupons, but it is all again about human behaviour. Parkinson's law is, that's bureaucracy, and the best thing about Parkinson's law is how that applied is because it's such a thin book. If someone was writing, about personnel now, or whichever way you want to describe how you run your human resources, well, that book would be the biggest of the lot. And good profit. This Charles Koch is he's the second or third richest guy in the States, and he has a very hands-off approach to the business that he buys and turns around. So I mean, he's a strong Republican, obviously, but but it doesn't mean that he's not looking after his business by looking after his staff. And the one that's hidden behind my book there is the big book, which is the biggest of the lot, is the biography of Steve Jobs. So it doesn't even have a title on it. But somewhere in there, it's about 360 pages in, he talks about how and why he set up his Apple stores, which are probably the most profitable stores. But they didn't replicate the stores that went before him. So why we keep thinking that we're going to do the same thing is nuts. And this is my office. So you can see the dentures there and all the other stuff. But I do go to the care home. So this is just to show what I did. So I had help with Yui 2 years ago with the idea of doing 3D printing as a way to help with the 14,000 dentures that go missing every year in care homes and hospitals. And the idea was to scan on your phone, which proved that couldn't work. However, I've just fitted a replica denture in a care home using a scanner that we trialled at UE back then, and it's not a dental scanner, it was just a basic scanner. The triple bristle brush, I bought one of them about 3 years ago. I've done a trial on it, it's on YouTube, and I thought it'd be rubbish, but actually I tested it against the Philips Sonic and the Oral-B, and it's just as good. And then those are cameras, so there's, again on YouTube I've got something about cameras, so they're £50 each or less. Now if someone in a care home can use a toothbrush, they can use a camera, so then they can help with the screening. And you can just see that what I did find with I think about 10 of these power brushes I took to the care homes, and they didn't get on with them. The residents, staff love them, they have them now. But the manual brush, so they also do a manual brush, which you can't buy in the UK. The triple bristle brush you can now, but only one dealership. The manual brush, that one is, and it's just to show where the bristles actually catch the gum. And the reason I like it is, whilst they're nowhere near as good as other toothbrushes, that's when you clean your own teeth. But when you clean someone else's teeth, it's a different ball game altogether. And so that's to make it easier for the carers. So I know that they get on a lot better with them. But I had to buy 50 of them, I think. So I've got about 30 that I'll be trialling or giving when I go for the product design. So I want to go through that process. I'll be handing out these brushes and again seeing how they get on with them. And so if you want to know what to do, you have to go and see the staff. So that's the case, and see how they do and how they work. And I really learned a lot when I was there last time. We had a 2-hour meeting, and part of that was in the video that I showed earlier about it was actually the girl on the left explaining how she thought that the residents didn't get toothache, they didn't get pain. They have more residents who give them the teeth that have fallen out, the natural teeth fallen out or exfoliated, than they do complaining of pain. And that surprised me. So what we can do is we can get people to do this. So I went on the course for this, I met the guy giving the talk, Oral Health Education England, HEE, Health Education England. And so they go do the rounds in the country. It's a very political thing, saying that we've organised these courses. Well, each of these apprenticeships, someone gets £9,000. There were 6, there are now 7 places in the UK that do it throughout the UK. So in our neck of the woods, if you're in Cornwall, or even if Bristol, you have to go to Yeovil to do the course. The dentist won't release you to do the course because they need you at the office. And it's a long old haul, and they're not being run that well from what I heard the second time I went to the course. But what they do, and what you can do, is you can learn how to do a plaque score, which is basically disclosing the teeth. With training, they can do impressions. Right? The intraoral scanning you don't need training for. Currently the GDC, you just have to be a dental nurse, but obviously you can improve on it. You can also apply a varnish, right? This one is the fluoride varnish, but the other product's SDF, silver diamine fluoride. And yet, taking photos and taking x-rays. Generally, you have to do that under the supervision of a dentist, but he doesn't have to be in the room. And that's what happens in the States. So often you have one dentist and you have lots of people just online with the dentist asking for an opinion. So there are sort of gaps in the education. So this was my view, is that we just do it all online. There's no better place to train than in the dental surgery. And all the things that you need to do, all the kits in the dental surgery, you've even got the patients in the dental surgery. The other aspects about it is, you think it's just almost a money-making venture for the educationist, in that we can have, if someone's going to do this, then you can do it all online and you can film it. You can film them giving fluoride varnish. You can film them taking the x-rays. You can film them, showing how to clean the teeth. It can all be done online. So, yeah, Henry Marsh, Do No Harm. That was the title for the book. And that's an interesting read, obviously. So, yeah. So, as you can see, I've taken these from another presentation that I was kind of doing. So the other part about it is for dentures. So you can get people to go in to care homes because they can make money scanning. So if a nurse goes in with a scanner that's redundant from the dentist he's not using at the time, and they're not, they're portable, the AI, we can use AI to design a denture. So you have to have teeth that meet. It's a different thing, but there's so much that we can do with these scanners. And I've just done it. I don't think I put a picture of the dentures up. I may have done. Anyway, this is a different way that we should work. So it's not just going to a practice. You can see there's a treatment unit. So the TCO is what they have in the States, which is called a treatment coordinator. And then you can see they've got the mobile dentists, right? Well, the mobile clinic. And teledentistry, we can do all that on giving advice from the care home by the oral health champion showing the photo. And again, so this is from another thing, but that's how it would work. It's the actual get a nurse or a hygienist to go to the care home. Currently, a dentist has to fit a denture. Well, if it's a replica denture, then that's just exactly the same as having your glasses, because they're done on a prescription. So this is a way that we can make it financially viable for people to go there, because you get the nurses to go there, and obviously there's a cost element involved, but to get a dental nurse to go to a care home is a lot cheaper than a dentist. So I put a few things on. It's a while since I did it, right? And these are all portable stuff. So and I made a dental app that you'll come across now and again. It's such a shame that I just needed the money to keep it going. But basically, the radiograph's now portable. The actual legislation is way out of date. From when I started, the dose that you get from radiation is tiny compared to what we got back in the day. And it's not the same as if you have 2 x-rays taken, it's the same as going on holiday to Portugal or eating a large number of bananas. We just don't need to have, or shouldn't need, the prescription from a dentist to do that. And then the scanner at the bottom right, I've given up now. I'm going to buy one, and I'm going to go around care homes showing people how they can do it. So this is the thing that I was saying from before about reframing. Now, I think this video will probably play, but if you look at the left, that's the objections to this, and on the right is how I think we can reframe it, saying that this product, which is just a varnish, a clear varnish, we just need to reframe it different. Right. So, that sometimes happens. But if you go onto the slide, if you type in SDF, it's a minute long, so it's on my shorts, and it explains how the silver diamine fluoride actually, the way it works is it destroys the bacteria in such a manner that they stay in situ, they stay within the tissue, but they ended up forming a barrier between the sugar and the active bacteria, so further bacteria die. And the downside is, not the downside is it makes the tooth go black. Well, this happens for children and it happens for adults in care homes. The interesting thing was that on some of the photos that I saw last year, someone commented on how the gums had stopped bleeding, and that's to do with the respiratory disease. So that's the thing that's of interest, is that how we can use this to reduce respiratory disease. And that it just forms a barrier. So in children, the tooth goes black, and that means instead of having the tooth out and having a general anaesthetic that costs over £1,000 per patient, you can apply a gel over the tooth. That same gel works for cervical, which is the decay around the gum margin of the teeth as the roots become exposed and the saliva of the elderly has less mineral content and there's less flow rate, all those things, so they're more prone to decay. But the biggest problem is the bacteria proliferation and change of the actual bacteria within the mouth. They go from aerobic to anaerobic bacteria, and they're the ones that cause more problems with your general health. Yeah, and then, so this is just thinking again slightly differently, is I think we can get people who go into care homes, whilst it will only take you 5 minutes to clean the teeth, I think you should go for 20 minutes and chat to the person. I had a patient who was an actress, and I said one day, "What are you up to?" She said, "I'm off to the care home. I go to talk to the residents. We have really nice chats, and it's doing her bit." Unfortunately, she got cancer, and she ended up there, and she didn't last that long. But I always remember thinking, well, what a fantastic thing that she was doing. You couldn't afford to pay her, and I think she got as much out of it as the people that she went to see. And there are lots of people like that, because my brother worked with someone, and the guy was quite successful. He decided to have a year out, and he had an Aston Martin, so he used to go around picking up people to take them to hospitals. And this is what Rory Sutherland says, is that the way that you can do things is that you can cheer people up, or the way you present things, and that's Cialdini, and the way that you say things, which I'm not very good at, can actually influence the outcome. So what I'm talking about is that we can actually go into care homes and clean in between the teeth so they don't get that debris cord, they don't get the bleeding of the gums, or it's a lot less likely, and at the very worst, they have a cleaner mouth and they have a chat. I didn't include the slides, and I'll find them again, which say that silver diamine fluoride has been applied in over 2 million cases for Japan for 70 years and with no ill effect. One of the studies that I think was on the Storm report I gave you said that they did a test with children to see if it was safe to use silver diamine fluoride, and they said it was. Well, clearly testing on children is a lot different to testing on the elderly who are, is it God's doorway or something? They're trying to put a pleasant description on it, but they haven't got long left anyway, so we want to make it as pleasant as possible, and by having a clean mouth, by using interdental brushes, again, that's the video I left out, but instead of that, what you can do is you can go onto YouTube, and this is the person I went to see, and I met her in the States, and she's got the video. So if you type in SDF application in care homes, it shows how she dry brushes the teeth in the care home, and I think that's going to be a huge game changer if we can get people to go in and do that. And afterwards you can give them, I've got some mints that sugar free, but they also got the mineral content I was talking about. And then I don't think the next picture is going to work, bearing in mind what happened before, is that because it's a video. Oh no, that's great. So for this to work, we need to empower nurses and the staff. But our Dental Health Act, it was made in 1984, and it is just, and the GDC who actually enforce it, it's just a nightmare. And I'm sure we get this with lots of professions, but they're hindering access and not helping anyone's well-being. So we need a new petition to do that. So I'm sure this is more than 10 minutes. God, it's half an hour. Anyway, this is my first attempt, and I'm going to try and run it through ChatGPT to see if I can get a shorter description.
To improve dental access, please sign the form on the Dental Health Service website.
Well, that's great. I was trying to turn it off. Anyway, that's what it's all about.